Colon cancer warning signs and symptoms you shouldn't ignore. Colon or colorectal cancer is the third most common cancer in adults. Although it is treatable when caught early, it can be life-threatening if left untreated. In fact, it's the second leading cause of cancer deaths in both men and women in the United States. Colon cancer begins when cells in your large intestine start to grow abnormally. These cells can form polyps, which can become cancerous or malignant. If this happens, they can spread to other parts of your body through lymphatic or blood vessels. Colon cancer may also begin with colorectal adenoma, or flat polyp, which is not considered malignant, but may eventually become so if it gets bigger or develops into a cancerous tumor or adenocarcinoma. Risk factors. Most people who get colon cancer are over 50, but you can get it at any age. If you have a family history of colon cancer or polyps, you're more likely to develop it. You might also be at risk if you have inflammatory intestinal conditions, eat a low-fiber, high-fat diet, have a sedentary lifestyle, have been diagnosed with diabetes or obesity, smoke, or regularly consume alcohol. Symptoms. Colon cancer symptoms can differ from person to person, but there are a few common warning signs to look out for, such as a persistent change in your bowel habits, including diarrhea, constipation, or a change in the consistency of your stool, bleeding from the rectum or blood in your stool, persistent abdominal discomfort, such as cramps, gas, or pain, a feeling that your bowel doesn't empty completely, weakness or fatigue, loss of appetite and weight loss with no apparent cause. Now, there are a number of things that can cause these symptoms, and many people with colon cancer show no symptoms in the early stages of the disease. When symptoms do appear, they can vary depending on the cancer size and location in the large intestine. That's why routine screening is so important. It can detect and even prevent some colorectal cancers. Detection. Your doctor will likely start with a rectal exam. You may also have a colonoscopy, which involves a flexible tube with a lighted tip inserted into your rectum that allows the doctor to see inside your colon. Screening often requires a fecal occult blood test as well, which helps detect hidden blood in the stool that's often caused by colon polyps or tumors. Your doctor may also order additional tests, such as a CAT scan, an imaging test that uses X-rays and a computer to create detailed pictures of the inside of your body, an ultrasound, which uses sound waves to produce pictures that show the size, location, and shape of the tumor, if any, as well as abnormalities that may be present in surrounding tissues, and a biopsy, during which they take out a small piece of tissue and check for cancer cells. Treatment. Colon cancer treatments may include surgery, radiation therapy, chemotherapy, targeted therapy, or immunotherapy. The type of colon cancer treatment depends on the type of cancer cells found in the colon. Prevention. The good news is that you can take steps to reduce your risk of colon cancer by making some lifestyle changes. Do the following. Eat a variety of fruits, vegetables, and whole grains. They contain important vitamins, minerals, fiber, and antioxidants, which may play a role in cancer prevention. Drink alcohol in moderation. Stop smoking. Try to exercise at least 30 minutes every day. Maintain a healthy weight. The bottom line is that it's better to be safe than sorry. So do whatever you can to reduce your risk of developing colon cancer. Make sure to get routine screening, and if you suspect you have it, don't wait to talk to your doctor about it. Thanks for watching. If you thought this video offered some useful information, give it a like and share it with your friends. It allows us to create more great content. If you want to see more videos from us, hit the subscribe button and turn on notifications so you never miss a video.